it is about 75 to 85% effective in preventing
Oh,
pregnancy. I know, right?
nice.
I know. Which, like, and you compare it to an IUD, which is over 99%. But again, this is all about like what are we prioritizing? I think for my patients who they're in a position where they're like, I don't want to get pregnant right now, but if I got pregnant, it would not be the end of the world.
Yeah.
Cool, let's do natural family planning. If you have a reason where if you got pregnant, it would be the end of the world, maybe it's not our best option. And the reason for kind of like the lower efficacy compared to the other methods is because it relies on two things. One, it relies on your body being pretty darn perfectly regular. And
Yeah.
some people are, but sometimes things happen. Sometimes you ovulate early or you ovulate late or you skip a period or you got sick and so that shifts your cycle.
Mm.
And we can't always predict our body to be exactly perfectly regular. And the other thing is that like it takes a lot of effort on your
Mhm.
part. If you think taking a pill every day takes a lot of effort, the components that are involved in natural family planning are like tracking your cycle and tracking basal body temperature and tracking your cervical mucus, like using ovulator predictor kits to see when you're ovulating and using condoms when you're in your fertility window or just not
Yeah.
having sex. And it requires so much effort on people's part. And so if people are down to do that, then I think it could be a good option. So I like the
Mm.
natural family planning method, and I kind of like the emphasis that people are putting on their natural cycle and how they can feel empowered. But I also do kind of encourage people. I feel like sometimes that emphasis on prioritizing natural things can sometimes come across as almost shaming women who
Yeah.
sometimes do use hormonal birth control. And people are like, how can you put all those hormones in your body? You have no idea what it's doing to you. And I think that's kind of what we're trying to do is like maybe unpack some of those myths. But
Yeah.
also, there are so many reasons to be on different hormonal birth control, non-hormonal, what have you. Some women use it to prevent pregnancy. Some people use it to manage PCOS or manage endometriosis. Or, there's so many reasons women can be on it. And so I feel like being a woman is hard enough. And so we should just respect that people are, different things work best for different people. And if it's not a good fit for you, it doesn't mean it's not a good fit for somebody else. We should lift each other up and empower each other to do whatever works best for you, whether it's a birth control pill or tracking your period or doing a condom or whatever it is.
Yeah. I love that answer. That's really helpful.